Okay, when we talk about cholecystitis, we are of course talking about inflammation of the gallbladder. The gallbladder is located right near the liver, and what it does is it stores and secretes bile. What bile does is bile helps with the digestion of fats. Okay, so after we eat, the gallbladder can secrete bile into the duodenum, where that bile aids in the digestion of fats. Okay, now cholecystitis, again, it's this acute or chronic inflammation of the gallbladder. Now that is most often caused by cholelithiasis or gallstones. Okay, gallstones can form as that bile sits in there. It can crystallize and it can form what are called gallstones. Okay, so as those gallstones form, they block off this little drain here, and the gallbladder starts to inflame. Okay, so what we're going to assess in our patient who has cholecystitis is they're going to experience nausea and vomiting. Okay, now that's not very indicative of much. So along with that nausea and vomiting, they're going to have right upper quadrant pain, okay, right near their liver, and it will generally occur 2 to 4 hours after high-fat meals. Again, we talked about how the gallbladder is going to release that bile to help digest fats. So after eating a high-fat meal, the gallbladder is going to be stimulated, and that's going to cause that right upper quadrant pain. This pain can last 1 to 3 hours. Okay, so if the patient's experiencing nausea, vomiting, they're having some right upper quadrant pain, you would ask them what elicits this pain. When does this pain begin? How long does it last for? Do you notice it happening at any certain times? Okay. Another thing that you're going to notice in your patients that have inflammation of the gallbladder is what's called Murphy's sign. Okay. Murphy's sign is pain with expiration while the examiner's hands are placed here. So as we palpate here, the patient is we're going to ask them to take a deep breath in, and then we ask them to try to expire. Okay, they won't even be able to breathe because the pain is going to be so great. Okay, that's known as Murphy's sign. Okay, so with this nausea, vomiting, this right upper quadrant pain after high-fat meals, and Murphy's sign, we have a pretty good indication that our patient is most likely experiencing cholecystitis. Okay, another sign is going to be rebound tenderness. We talked about this in a couple other videos, but rebound tenderness is going to be as we press on that, when we lift up, there's going to elicit a pain reaction. Okay, so those are kind of what we're going to see in our patient that has cholecystitis, and that's how we're going to be able to differentiate it from appendicitis or hepatitis or something like that, is this right upper quadrant pain after meals and Murphy's sign. So what's going to be our management for this? First of all, we want to keep our patient in PO. Keeping them in PO is going to decrease the stimulation for bile, which is going to eliminate that pain reaction, and it could help prevent some of this inflammation. We're going to give them antiemetics to help with the nausea and vomiting. We can insert a nasogastric tube to help with decompression of the stomach. We can also give analgesics, and we're going to want to avoid gas-forming foods. And all this is going to be leading up to what is known as a cholecystectomy. Cholecystectomy, of course, ectomy is going to be to remove, and we're talking about the gallbladder here. Okay. So what we do here is we're going to monitor for pain and infection at the site. So once it's removed, and one thing you might hear is people talk about a lap chole. I had a lap chole or whatever that. What that means is a laparoscopic cholecystectomy. Okay, so it's removal of the gallbladder laparoscopically. But post-op, we're going to monitor for pain and infection at the incision site, and we're going to instruct the patient to on abdominal splinting when coughing. What that is, they can just apply a pillow there or apply some pressure there when they cough, and that will help to prevent evisceration of the wound site. One other thing that may be inserted for this patient is going to be a T-tube. what a T-tube does is it helps keep that duct patent. Okay, so we need to keep the duct leading into the duodenum patent. Okay, so a T-tube might be inserted, and what that T-tube does, it just keeps that patent while the patient's healing. And they'll have a drain where we can monitor how much bile is being secreted. Okay, so after they eat, we're going to be monitoring those secretions, and we're going to want to report any drainage greater than 500 mils. So we want to keep our patient in the high Fowler's position, and we're going to keep that T-tube open unless instructed by a physician. What the T-tube does is it just allows to keep that duct open, and it allows that bile to drain while the patient is healing from surgery. Okay, so those are kind of the basics of cholecystitis and cholecystectomy. If you have any questions, be sure to let me know, and we'll see you soon.